rapid weight gain. No matter what I was doing everything right. Crushing fatigue, the hair loss, all of it. That really just kind of consumed my life at the time because it felt like my body was rebelling against me. If any woman that's been on birth control for more than 10 years, at any point of time in her life, even if you've been off of it for 15 years, you were on it for 10 years between 18 and 28, you are at a 243% increased risk of hypothyroidism. Undereating and over-exercising is enough to make your thyroid condition much worse, or even trigger a thyroid problem when you didn't even have one. If 6 doctors tell you that you're normal and everything is fine, and you know innately that you're not fine, this isn't normal, this is not how I'm supposed to feel, then you keep going and demand the answers, but have hope at the same time, because you will find the answers. You will find someone to help you, whether it's myself, it's Reagan and his team. Someone out there can help you.
Welcome to Unreasonable Health. Today I've got Dr. Amie Horneman, and she's known as the Thyroid Fixer. And so for those of you who think you know about thyroids, I think you're in for a treat today, because she runs the top-rated medical podcast, The Thyroid Fixer. She's got unique insights. She founded the Better Thyroid and Hormone Institute, delivering personalized thyroid and hormone health across the US and Canada. She's the creator of the Fixer supplement line, which I'm excited to talk to you guys about, this special thing called T2. And Dr. Amie designed formulas that target issues she saw with her patients who struggled with weight loss, fatigue, low libido, hormone imbalances, and many other things. So she's been inspired by her own journey with thyroid and hormone challenges, and is dedicated to helping others navigate these issues with empathy and expert care. Dr. Amie's mission is to optimize your health, restore your life, and empower you to become the badass human you're meant to be. Dr. Amie, welcome.
Woo! Happy to be here, Reagan. Thanks for having me on. Beautiful intro. Thank you. All the same things that you see in your clinic as well.
Well, the crazy thing about it is, if you think of the thyroid epidemic in our country, like 20 years ago, I thought it was going to be better, because that's how I got into this field. You know, it was 25 years ago. I was finally a naturopathic doctor's like, oh, you've got Hashimoto's. And I was like, what is that? And, nobody knew about it, and it was rare for men to get it and all those things. But all the chemicals I was exposed to on the farm. And so I imagine that we would have a much healthier thyroid understanding 25 years later. But what do you see out there as far as thyroid health goes?
Oh my gosh. Well, same thing. So mine was around 25, 27 years ago. I was misdiagnosed 6 times, told that I didn't have a problem. I was normal. Everything was fine. Then that 7th doctor finally diagnosed me. So I cannot wait to have you on my show, because we're going to get into your story too. I did not know that about you. I just learned something. So no, what I see is in the conventional medical system, same issues 25 years ago of misdiagnosing, not testing properly, not treating properly. And yes, definitely an increase of hypothyroidism, Hashimoto's. Hashimoto's is the autoimmune form of hypothyroidism. Definitely an increase, because just like you were exposed to all the toxins and chemicals, now we've seen an uptick in our world of toxins, chemical exposure, stress. Just stress alone, life stress has significantly increased. So I think all of those factors come into play to turn on that autoimmune switch, to flip that switch for Hashimoto's to the on position. And we're seeing more and more people diagnosed with it. And then on top of that, there's people like you and I actually out there talking about it and educating people, so that that woman 20 years ago that's like, wow, I'm gaining all this weight and I'm so tired and my hair is falling out, but my doctor said it was normal, and I'm just getting older, so I'm just going to forget about it. She didn't have the resources that we're providing now to actually step back and go, wait, no, that is not normal to feel that way. That is not normal to put on 15 pounds in 2 months. I'm going to go do something about it, or I'm going to work with an expert, or I'm going to keep plugging away until somebody does listen to me. And those resources are out now, I think, making people more aware of thyroid disease.
And what happened with you? I mean, your misdiagnosis, I mean, it definitely shaped your future, but what was that like, and what were some of the symptoms you experienced?
So I was actually competing. I was doing fitness and figure competitions. I was doing fitness modeling. I knew how to get my body into that low body fat percent shape to stand on stage, to get in front of a camera, wear a bikini, whatever. And you would always diet down for that. It was always like an 8 to 12 week diet of chicken, broccoli, asparagus. You hit the gym twice a day, all the things. And my body responded the same way every time. I knew what I had to do. This one show I was getting ready for was a really big show. And I was working with a trainer, I was working with a coach, had to send in my progress pictures, send in my weight every single week. And I'm doing all the things and the scale's going up. And it's like, oh, wait, is it me? Do I have to restrict more? Do I have to add a third workout in? What's going on? And I'm talking not just like a couple pounds. It went up a total of 25 pounds. And that's when I stopped getting on the scale. I believe it went up a total of 40 pounds actually overall. Rapid weight gain, no matter what I was doing everything right. Rapid weight gain, crushing fatigue, the hair loss, all of it. That really just kind of consumed my life at the time because it felt like my body was rebelling against me. It felt like I wasn't in my own skin. It was out of control, almost like like an avalanche. Just my body was out of control. So I did what we all do. I went to my doctor and said, hey, this is going on. I didn't know anything at the time. I wasn't even in functional medicine at the time. And I said, hey, this is going on. And, he ran some tests. Would love to go back and see, but we can only imagine probably just TSH, maybe some free T4 in there. Yep. Ran some tests, said, you're normal. You're within normal limits. You're normal. Everything is fine. So I kept going and I kept going to doctor number 2, 3, 4, 5, 6. All of them had some kind of medical gaslighting excuse that it was in my head. I just need to work harder. I'm not being honest with my diet, all the things. Finally, the 7th doctor, still in the conventional system, normal endocrinologist, she actually touched my throat and said, swallow. She was the first one to lay hands on my throat.
Isn't that crazy?
First one.
The first step in a diagnosis is
just, I mean,
feel it.
Feel it. And she felt nodules. And I believe she must have done a couple more labs because she says to me, she's like, you have Hashimoto's. We're going to get an ultrasound of your thyroid, but here's a pill. And I mean, Reagan, come on. I was so excited. I left her office. I'm like, this is awesome. I'm going to be fixed. I'm finally going to lose this weight. I'm going to get my life back. Oh my gosh, there's a name. Now I have a diagnosis. I have a name for my body rebelling against me. So I gave that pill 6 months and nothing happened. I didn't lose any weight. I didn't feel any better. My hair didn't grow back, nothing. And now I know that I was given T4, the inactive thyroid hormone. Long story short, I don't convert at all. I'm actually a T3 only girl. And so I just kept getting worse and worse. And it wasn't until I found functional medicine, and this in particular is functional medicine practitioner. I kept hearing his name over and over again. Finally listened. I'm like, okay, I get it. I get the message. I'm going to go. And he saved my life. He did all the right testing, the right treatment, the whole thing. So that's what shifted my career into functional medicine because I experienced it and I experienced the life-changing effects of it.
Isn't it crazy? Levothyroxine, I mean, it's been around since 1950 and it's still the most prescribed thyroid drug. I mean, it's usually in the top 5 most prescribed drugs in the United States, but it often doesn't work. And actually, some of the binders in it, the cornstarch can be influencing more of the autoimmunity in thyroid issues. So crazy that it went that way. So what would you say the most common misconceptions around the thyroid are that you've seen?
Well, we kind of have to break it down. So if it's conventional medicine misconceptions, it would be the whole standard of care that all you have to do is test TSH. And if TSH is above that 4.5 cutoff, which that's a whole other discussion of what's optimal and what's normal.
Right. Yeah.
If TSH is above a 4.5, give the patient T4, send them on their way, recheck them in 6 months. Oh, Sally, I'm sorry, you're not feeling any better. Let me increase your T4. And they're just not doing the right testing. They're not checking for conversion issues. And then the poor patients, I mean, you and I see them all the time. They're like, well, I just stopped my medication because what's the point? I'm not feeling better, or in fact, I'm feeling worse. And this is supposed to fix me, and it's not. So I would say that's the biggest misconception I see in conventional medicine. And then obviously the poor people listening to their conventional docs, they get gaslit, and they believe that is it. This is the only answer. And if this isn't working for me, I must be this tough case that just can't be helped.
And I think a lot of people out there who are struggling, if you look at the thyroid, it's usually secondary to other things. And you talk about this a lot. But if we just kind of broke down all of the mechanisms for somebody who knows nothing about the thyroid, maybe someone listening and you don't even actually understand, like, why is it important to have good thyroid hormones? But maybe we could just talk about why the thyroid can sometimes be the canary in the coal mine. It can be reflective of something else going on. And we can talk about why every cell in the body needs thyroid. And maybe you could just kind of give us a little thyroid 101.
Yes. Well, you just said it. Every single cell in the body needs thyroid hormone. And if it doesn't get it, it's going, that organ, that gland, that system is going to be affected. Now, there's also, just like you said, the canary in the coal mine effect of, okay, if I have these symptoms and it looks like it's the thyroid and we test thoroughly, well, is it that in men, I see this a lot. I don't know if this was your case because it was 25 years ago, but oftentimes I will see low testosterone, and then that almost like that protective barrier that testosterone gives us against autoimmunity, that veil is dropped. So now we see men getting diagnosed with a thyroid problem, specifically Hashimoto's, because that testosterone was so protective. So now they have low testosterone and a thyroid problem. Now, which is it? What do you treat? Well, in my world, you do both. I mean, let's get your testosterone levels up so you have that protection, but then let's also actually treat what we're seeing on your thyroid labs. Everything is so interconnected. The adrenal glands, T3, the active thyroid hormone, needs cortisol. Cortisol needs T3. They work together. If cortisol is pumping out, you're under massive amounts of stress, you're just high cortisol all the time, that's going to affect how you convert your inactive thyroid hormone T4 and even what your thyroid gland produces. By the way, let me back up. Your thyroid gland itself, if you still have a thyroid gland, produces T4 and T3. So it produces the inactive thyroid hormone and it produces the active thyroid hormone. T4 is totally inactive and has to convert and become T3. So I want to lay that groundwork for anyone listening that's like, what is she talking about conversion? T4 has to become T3. And in that process of converting to T3, a lot of things can interfere. So if someone does have a conversion problem, like I said earlier, I can't take the inactive thyroid hormone. I have to go right to the active, skip the middleman, skip the conversion, all of that, and take the active thyroid hormone. If someone has an issue with converting, that's a canary in the coal mine. Let's look at your insulin. Let's look at your estrogen. Let's look at your cortisol, because that high cortisol is going to impair conversion. Let's look at your gut. Let's look at your liver, your detox pathways. Everything is so beautifully and intricately connected in the body, but we can't forget about the thyroid that's the master gland controlling the show. And I mean, really, you have to. And I know you do this too. You have to do it all. You have to look at hormones. You have to look at thyroid. You have to look at the full body. And that's what functional medicine does. But we can't forget that the thyroid is the master gland.
And what do people feel like? And you can even talk about your own experience, but what's the difference between having an underperforming thyroid versus an optimally performing thyroid? What's your life like?
It's funny you ask that. I always joke about like inviting people to join me in optimization land. It's a beautiful place to live.
Yeah,
it's a beautiful place. It's where you get up every morning, and if you want to have coffee because you like the taste of it, you can have it. But guess what? You don't need it. You don't need to fuel your body with caffeine and Red Bull to get through your day. You're not gaining weight looking sideways at a brownie. You eat well, you maintain a healthy weight, but yet you can have your gluten-free pizza, you can have a glass of wine, you can go on vacation and not
Yeah.
be stressed out on vacation about being too damn tired to do anything or being 20 pounds heavier when you get home, 10, 20 pounds heavier. So it's just, optimization land is where you are living life and you're like, life is good and has nothing to do with age. It doesn't matter if you're 30 or 70. You are just living this really great life as opposed to not being optimized where you're like, oh man, I don't want to go out tonight. That means I have to put on some clothes and the clothes are going to be tight. And then I'm going to go out with my friends and I'm going to have to order something to eat. And they're all going to want to have a glass of wine. But I know what wine does to me. I'm going to be 5 pounds heavier tomorrow, probably 10 pounds if I have an appetizer. Oh, and I'm too tired anyways. I want to be in bed by 8:30 because I have zero energy to get through the day. My hair's falling out. Do I wear extensions? Do I wear a hat? I don't know. Like I'm so self-conscious. I haven't pooped in 3 days. Like that's what it's like not being optimized.
Otherwise, no problem.
Right. Exactly.
Wow. And so if people just kind of look at it, if we look at the cause of the cause, I mean, there's so many things environmentally, but there's also like from some of the misconceptions out there, I think a lot of times we forget that even birth control, for example, can be a big detriment for thyroid health. And maybe you could touch on that just a little bit because I want all my listeners to have lots of babies. And so maybe we'll just get them off birth control.
Yeah, please do. So here's a stat for you. Very interesting stat. Any woman, and this is me included, I'm not speaking from a pedestal. Any woman that's been on birth control for more than 10 years at any point of time in her life, even if you've been off of it for 15 years, you were on it for 10 years between 18 and 28, you are at a 243% increased risk of hypothyroidism. It is huge.
Wow.
Yeah.
Wow.
Yeah. Yeah. Those synthetic hormones, they just tank the thyroid. So we know, triggers of thyroid dysfunction. We have Epstein-Barr virus. Honestly, I haven't met a person yet. I'm wondering if you have. We'll have to compare notes. I have not yet met a person who doesn't, I know this is double negative, doesn't have Epstein-Barr. Everybody has it. And even people, myself included, when I tested, it's dormant, but it's positive. And I go, I don't remember having mono, but I must have. It must have just been a really bad cold. Epstein-Barr virus, underlying infections. Yes, birth control is huge. Other, certain medications like beta blockers can trigger thyroid dysfunction, but then even just hormonal changes. Women forget that something like pregnancy, very natural to do. Yeah. Hormonal nightmare roller coaster cascade for your body. And sometimes that's enough to turn on that Hashimoto switch. So that's when we'll hear women say, it was after my second kid that I just couldn't get that weight off and I lost all my hair and I became so tired. It's like all my symptoms came on after my second child. And then we have perimenopause and menopause, another time of hormonal shifting that is enough to sometimes just flip that switch to the on position. And then women are like, is this because I'm getting older? Is this the whole menopause thing everybody talks about? Or is it something that I like to call thyropause, which is when your thyroid craps the bed after the age of 40 due to those fluctuating hormones?
Wow. And so, looking at that thyroid pause, which that's an interesting term, makes a lot of sense. What are some of the things that women do at that age? I mean, is it always get on thyroid medication or what do you find can help?
Well, the bottom line is thyroid and hormones give us life. So if you are no longer producing enough thyroid hormone and we've tried, let's say the nutrients and we tried the selenium and the iodine, the magnesium to try to get your thyroid to kick up more thyroid hormone. And it's not working. The free T3 is still low, reverse is high. We've done all the things. Then it's time to have that conversation about replacing thyroid hormone. Just like we talk to men and women about replacing their sex hormones. Yeah. So as we age, we start to lose progesterone, estrogen, testosterone. The benefits of those beautiful hormones are just too many to even list in this show, but that's what gives us that longevity and that health and prevents disease and on top of giving us a great life. Same thing with thyroid hormone. And if it is needed, just like any hormone, when your body is not producing enough of it, we can replace it. If we've tried all the other things and you got the lifestyle components down, then we can replace it. And then that just brings up that quality of life and makes aging so much better, so much easier.
Yeah, no doubt. Well, you've got this interesting perspective. Like you were able to dive deep and uncover something that most people don't talk about, most doctors don't talk about in the world of thyroid, and that's T2. And let's talk about that a little bit and how that plays into this whole thing. So just to recap for everybody, T4 it's an inactive form of thyroid hormone. It's got to be converted, and there's a whole metabolic step that goes through the liver, the gut, and then it becomes T3, which is the active thyroid hormone, and it needs to be a smaller molecule to bind on the receptor sites in the cells. But what is T2, and why is that important?
I always call T2 the forgotten thyroid hormone because we don't talk about it, like you said. Well, because it's not in pharmaceutical form. And T3 and T4 both require a prescription. So, when something isn't a prescription, isn't in under the big pharma label, we tend to not pay that much attention to it. There's not as many studies done on it, but luckily we do have studies on T2. And what it shows is that it is an active thyroid hormone. So back to your own thyroid produces T1, 2, 3, and 4. T1 inactive, we're just going to set that aside. We already talked about T3. We talked about T4. T2 is also a very active thyroid hormone. And your receptor sites love it, specifically your mitochondria. And it works at that mitochondrial level. So at the mitochondrial level, it stimulates the mitochondria, produces more ATP. So that gives people really nice, steady energy through the day. So it's not a caffeinated energy. It's just this really just steady energy through the day. And in addition, it actually works to increase your basal metabolic rate, your BMR. So the amount of fat that you are burning at rest. It stimulates thermogenesis. It browns white adipose tissue. So we're always, jumping into cold plunges to brown our white fat and to be more metabolically active and to have better insulin sensitivity. T2 does all of that. And here's the really interesting thing about T2. So I mentioned before, I was in the bodybuilding, fitness, figure world. And in that world, I really call bodybuilders the OGs of biohacking because they would try stuff on themselves long before. I think we were doing peptides.
They're the ones that brought peptides to the forefront. I mean, thank you, bodybuilders.
Right, exactly. So they got this figured out. So this is years ago, I was watching an interview of one of the top trainers to the professional bodybuilders. And he was talking about women specifically. And he said, I don't let my women use T3 to get ready for a show. Here's the thing. I mean, realistically, guess what? Bodybuilders are using and abusing T3 to lose body fat because T3 is the active thyroid hormone and it will increase your metabolism. However, he said, I don't let them use T3 because T3 will burn your muscle along with the body fat. But here's these women that have worked so hard to maintain that lean, sexy muscle tissue, and they only want to lose body fat. It's burning some of their muscle, and it's actually causing a thyroid problem. So end of the show, they come out the other side. Now they have created that negative feedback loop with the hypothalamus and pituitary. Now they have given themselves hypothyroidism, and because they've shut down their own thyroid production. T2 doesn't do that. It only targets body fat. It leaves muscle alone, and it does not shift your thyroid lab values. It doesn't affect the thyroid itself. So your thyroid gland still produces the same amount of thyroid hormone that it always has. Some T2 can become T3, but very, very small. So if you're coming in with a low free T3, I'll throw out a number, let's say a 2.5.
Yep.
Yeah, by taking T2, you might get to a 2.7. It's not going to push into the optimal range and you're not going to go hyperthyroid at all, but it is going to help you with those main symptoms of hypothyroidism, weight gain or inability to lose weight, and that crushing fatigue. So it does help with those two.
Wow. And T2, so it's not found very often. I mean, you've got a really cool, I think you call it the fixer. You've got a cool supplement where you've actually been able to source it. What is it made from?
T2 is just manufactured just like T3 and T4, just like, let's say, Synthroid and Cytomel. We know that it's manufactured in a lab to be biologically identical to what you produce. So the really big, long chemistry term for T2 is 3,5-diodo-L-thyrionine. And when it's made, it's produced the same way as T3 and T4 to be biologically identical to that T2 that you make. And actually, T2 is, you find a little bit of T2 in natural desiccated thyroid medication, so your Armour, your NP thyroid, because it does naturally occur in the thyroid gland, even in a pig. So we do find it in very small amounts, but the studies that were done on humans, they were showing an average of 150 to 300 micrograms used, which is that's what I put in Thyroid Fixer and Metabolism Fixer, because that's what the studies showed were used on humans, where they achieved a 4% reduction in body fat and an average of a 9-pound weight loss in 28 days of using T2. So that's what I added to both Thyroid Fixer and Metabolism Fixer. Both of those have T2 in it, because that is the beauty right now. Praying that it stays this way. Big Pharma does not have its hands in T2. So you can get it in supplemental form, and you don't have to go to your doctor and like, please, doctor, I'm gaining all this weight. I can't lose, and convince your doctor to actually treat you properly like I had to do. But yeah, you can get it over the counter.
Wow. Fascinating. And so if you look at the expression in the body and specifically relating to the thyroid, let's talk a little bit about insulin and then the gut. So how much does blood sugar and hypoglycemia or hyperglycemia, how much does that affect the thyroid?
Well, it's both ways. So the thyroid affects glucose regulation and insulin regulation. So we'll often see, I'm sure you see this as well, we'll often see people that have been diagnosed diabetic. I have this one woman in particular I'm thinking of. She was type 2 diabetic. She's not anymore. She reversed it. Was type 2 diabetic, was on the GLPs, like prescription, Wegovy, Trulicity, Ozempic, whatever she was on, was not working. She wasn't losing any weight. Her A1C wasn't even moving. Like it went from maybe like a 13 down to a 10. So she was still full-blown diabetic. And again, she was being treated with T4 only. Her thyroid was not optimized whatsoever. So we started working on her thyroid. We added in sex hormones. And then all of a sudden her A1C dropped to a 5.4. So she reversed her diabetes. I mean, we're still working to get that a little bit further down, but my gosh, I'm not complaining. No. And she lost like 100 pounds. So it's really, you have to look at the thyroid gland controlling your insulin and glucose regulation. And these are the people that are like, I am doing everything. I'm on carnivore, I'm on keto, I'm tracking, I've eliminated seed oils, I've done all the things, and I'm still coming in insulin resistant or type 2. So that's the thyroid effect on that. But then we have the reverse. So then we have people that maybe they haven't done all the things, they aren't eating great, they are consuming too many carbs, even if they are tracking. They're just, their macros are off, or their lifestyle is off, or they're not sleeping, or they have gut issues, or something is driving their blood sugar up and their insulin up. So they are basically pre-diabetic, insulin resistant, or diabetic. Well, that is going to increase reverse T3. So this is where that T4 to T3 conversion comes in that we talked about earlier, how T4 has to convert to T3. And I'm sure you've talked about this, but just for the listeners, like we'll bring off the speed. The only thing that can convert to reverse T3 is T4. So if you give someone a boatload of T4 and they have this high insulin, high glucose, that's going to hinder that conversion and push up their reverse T3. Reverse T3 is your anti-thyroid hormone It's putting you into survival mode. We want reverse T3 built into our body if we're lying there in the ICU or the ER fighting for our life, because at that point in time, our body knows you don't have to lose weight. You don't have to make major decisions. You don't need a memory. You don't have to think. You don't need energy. You just have to lie there and survive. So reverse T3 goes up. Thank God. It's built into us for a purpose. The problem is if you have the things that increase reverse T3, if you're pre-diabetic or insulin resistant or any of the other factors, that's going to increase reverse T3. Now your poor body is in survival mode as you're walking around trying to live life every day. So it is just that back and forth relationship between dysregulated glucose, elevated insulin, insulin resistance, and the thyroid.
Man, and as far as the gut goes, what do you see that happens in the gut? And I know leaky gut's a term that's thrown out there a lot, intestinal permeability, but that does seem to have a big impact on thyroid health.
Yeah, 20% of conversion of inactive T4 to active T3 occurs in the gut. And then in addition to that, like we talked about at the very beginning, why the uptick of autoimmune conditions, why this uptick in Hashimoto's. Right. And we know that everything we are exposed to, the toxins in our water, the chemicals in our water, the pesticides on our food, the hormones in our food, I mean, really everything that we are exposed to goes through our gut. I mean, you swallow it, it's going through your gut, right?
Right.
So all of those, and I'm breaking it down basically, but all of those bad things can get into your bloodstream, get into your system and go systemic, causing inflammation. And that can trigger an autoimmune condition, or it can just basically affect your thyroid and just tank that on its own. So the gut is our barrier between us and our exposure and what we take in and our thyroid and the rest of our body. It's our protection. And ultimately, we want to be able to filter out toxins, have our detox pathways working, have our liver working, all the things. But the bottom line is some things get by. Some things pass through that goalie in our gut. And when those bad things, or we call lipopolysaccharides, when those LPSs get into the bloodstream and into the body, it just causes this inflammatory response that obviously can affect any system in the body. But since we know that 20% of conversion happens in the gut, yeah, there's an impact on thyroid.
Yeah, big time. Well, and even the thyroid, you mentioned constipation, you gave the analogy of the person who hadn't pooped in 3 days. And it's like, you have receptors in your gut that help stimulate peristalsis. I mean, if you want to have good bowel movements. So if we took a step back, I mean, there's a lot of things that you've developed over, your career helping thousands of people with thyroid issues. But what are like some things people could do right now to facilitate in great thyroid health, like foods they could eat, exercising, fasting? How does fasting impact it? The thyroid, all those things.
All those things. Okay, so first I like to start with the nutrients.
Yeah.
So the nutrients that are just desperately needed by your thyroid. We know selenium is important. Magnesium is important, all different kinds of magnesium. We know vitamin D is important just for your immune system, keeping that level optimized. I am a huge fan of iodine. I'm going to throw a question back at you and get your take on it. So yeah, I'm a huge fan of iodine. Obviously not dosed to the max. You got to work your way up so that you don't get a thyroid storm. But the bottom line is iodine is vital for thyroid hormone production and for bringing down reverse T3 and helping with conversion. So I really like to start with the nutrients. And then we kind of start going out into those other factors that we talked about when it comes to conversion. Are you insulin resistant? Is there something we need to do over here, like add in berberine? Obviously, change your diet, change your lifestyle. How are you sleeping? And then we can move over here and go, okay, are you estrogen dominant or your hormones just tanked out? Do you not even have that protective testosterone? Well, let's work on that over here. But for at home, I know you're asking, well, what can listeners do right now? I would say get all the nutrients in that we just talked about. Do not over fast, especially my ladies.
Yeah.
You have to be getting in your protein. And this isn't directly tied to the thyroid, but we know, and we talk about it all the time, how important amino acid intake, protein intake is, especially as we age. We actually need more to protect our muscles. I have not seen a woman able to get in 120, let's say, grams of protein when she's fasting for 20 hours. It just doesn't work. Like a 4-hour eating window isn't going to cut it, ladies. So, and fasting is a stressor. Your body is already stressed out if you have an autoimmune condition. Your body is stressed out if it's fighting to convert that T4 to T3. You don't want to overfast. I think, a 12 to 16 hour fast is perfect for my ladies. Guys can get away with it a little bit longer because you can get in the protein. You can eat, 2 steaks in a sitting, where women are like, oh, I'm full. So yeah, fasting, just watch that. And goodness sake, don't over-exercise. Because under-eating and over-exercising is enough to make your thyroid condition much worse, or even trigger a thyroid problem when you didn't even have one. But that's what we tend to do when we are not losing weight and we're gaining and our clothes are getting tighter and all the things. It's like restrict more, work out more. Restrict more, work out more.
Crazy. Yep.
And that's a huge stressor on the body. So that comes back to the adrenal discussion. See how everything is beautifully connected? That comes back to the adrenal discussion, where you're going to pump up your cortisol and then you're going to impair your conversion too. So, yeah.
Wow. Yeah. And as far as like T2, any tests that you've come across where you can actually measure the volume of T2 in the body? Only
in the studies. They don't have it available for us to order for someone at Quest LabCorp. It's not just a normal assay that we can order. But really, it's one of those where it's kind of like iodine, where it's like you just take it and you're going to be able to feel where your optimal is. Yeah. It might be that you need 75 micrograms once a day, and that's enough to take the weight off, maintain that steady weight, have really good energy through the day, or maybe you have to kick it up to 300. But you're going to find that happy medium, that happy dose of where you need to land with T2. And the beautiful thing is it has no cardiovascular effect. So it's not like you're going to feel like you're taking a fat burner from the 90s where you felt like you were having a heart attack, like with ephedra and caffeine and all that. I mean, it's just, it's going to be just this nice, like, I just have nice steady energy through the day. This is wonderful.
Man. And if you look at the, the future of thyroid health, what would you change in our food supply if you had make America healthy again? I mean, we're on that bandwagon, and so what are some things that you could see that would make a huge difference for everybody globally?
Well, I think they're already working on removing fluoride from our water.
Finally,
right?
Sheesh.
Oh my gosh. I interviewed a biological dentist last week, and I knew fluoride was bad, but she kind of blew my mind with the stats. And she brings up something very important and very common sense. Like, have we noticed a decrease in cavities since adding the fluoride to the water? No, we haven't, but we do know it's highly toxic to the thyroid. It lowers IQ in our kids, specifically boys. So yeah, fluoride right off the bat. Yep. And then, gosh, beyond that, there's so much garbage in our food. Like you said, I think the MAHA movement of truly removing these toxins, I know it's going to take a while. I live in Iowa. I saw a plane last summer flying over, spraying the crops. I'm like, well, that glyphosate's coming on over here, isn't it? I mean, there's only so much that you can do as a person. And in that, maybe it is that you buy organic as much as possible. You get a water filtration system in per your budget, but all those little things that you can do to protect you and to reduce the toxic load coming into or onto your body, changing out your body wash, your skincare, your makeup, ladies. I mean, all of those little things, even though they seem so minuscule, they really do add up to greater protection of your body and lesser exposure to those toxins that are going to affect you one way or another, whether it's your thyroid, your hormones, your adrenals, kicking up cancer, Alzheimer's, all the big bad things down to the little things.
Man, well, this has been fascinating, and there's so many things that you've done to revolutionize the thyroid world. What's the best way for people to find out if they have thyroid or hormone issues?
Yeah, absolutely. So we actually designed a lab quiz. So it's an assessment where it doesn't matter if you don't have all of the labs, you can at least go in and go through our questions, and it will give you immediate feedback on what each of your lab values mean. So if your TSH is, let's say, above a 2, it's coming in at a 4. Well, that is a huge sign in functional medicine that there is a thyroid problem. So we're going to go deeper. Okay, what's your reverse T3? What's your free T3? And that's a great way to guide you through a process so that you can look at your labs the way that we would, not the way your conventional doctor is looking at them going, you're normal, you're within normal limits, you're fine. We're looking at it from an optimal point of view. So we ultimately want every single one of your labs in that optimal range because we know that's where you're going to feel your best. So we have that at dramie.com/labs. And then on the Dr. Amie site, on dramie.com, you can find all the blogs. You can link to the store to get your thyroid fixer, metabolism fixer. If you want to give that a try, see if it boosts your metabolism. You can book a call with me. You can find my podcast on there. So that really is the central hub. And then, of course, all social media platforms. I'm on there as Dr. Amie, so you can find me.
Awesome. And one of the generous things you did is for those of you who want to try the T2, it's in both the thyroid fixer, the metabolic fixer, metabolism fixer. I mean, and so you can get 20% off listeners to the show. So we will provide that link in the show notes. And Dr. Amie, any final words of wisdom or things that I missed on the interview today? It's been so informative.
Oh, thank you so much. Now, the biggest thing I'll leave people with is that your symptoms that you have, so whether it's the ones that we talked about today, the weight gain, the hair loss, the fatigue, the constipation, even into, anxiety, depression, brain fog, memory loss, just loss of motivation, joint pain, any of those symptoms, I want you to look at those as gifts by your body, GIFTS, gifts, presents given to you by your body. Because, and I know right now you're like, that's not a gift. That's a horrible gift. Like, I want to send that one back, right? I get it. But it's a signal that your body is giving you to look a little bit deeper, because our bodies were not built to be fat, frustrated, and fatigued. We were built to be in optimization land till our last day on this earth. So if you are having symptoms, that's just your body being like, hey, me, can you pay attention? Can you pay attention? Because if you don't, those symptoms are going to get louder and they're going to get more. They're going to be more symptoms. They're going to multiply and they're going to get louder. So listen to those symptoms now and dig deep to find out what is that root cause of those symptoms you're having. And then just have hope that things can change, because you heard my story. If 6 doctors tell you that you're normal and everything is fine, and innately that you're not fine, this isn't normal, this is not how I'm supposed to feel, then you keep going and demand the answers, but have hope at the same time, because you will find the answers. You will find someone to help you, whether it's myself, it's Reagan and his team, someone out there can help you. So you have to have hope that things can change.
Man, I love that. And that's really powerful, because if you don't take action, things tend to get worse. So Dr. Amie, this has been phenomenal. Really appreciate you taking the time to talk to us today. For those of you who would love the show, make sure you share it with your friends, family, loved ones, and go check out Dr. Amie. Take the thyroid and hormone lab quiz that she's created, dramie.com/labs. And Dr. Amie, thanks again for being on the show.
It's been my pleasure. Thanks for having me.
You got it.